Hey everyone, welcome to Advanced Exercise Physiology, Chapter 24, Exercise and the Environment. The objectives of this chapter are 1. To describe the changes in atmospheric pressure, air temperature, and air density with increasing altitude. 2. To describe how altitude affects sprint performances and explain why that is the case. 3. Explain why distance running performances decreases at altitude. 4. To draw a graph to show the effect of altitude on VO2 max and list the reasons for this response. 5. To graphically describe the effect of altitude on the heart rate and the ventilation responses to submaximal work and explain why these changes are appropriate. 6. To describe the process of adaptation to altitude and the degree to which this adaptation can be complete. 7. To explain why such variability exists among athletes in a decrease in VO2 max upon exposure to altitude, the degree of the improvement in VO2 max at altitude, and the gains made upon return to sea level. And 8. Describe potential problems associated with training at high altitude and how one might deal with them. 9. To explain the circumstances that cause physiologists to reevaluate their conclusion that humans could not climb Mount Everest without oxygen. 11. Explain the role of hyperventilation plays to helping to maintain a high oxygen hemoglobin saturation at extreme altitudes. 12. List and describe the factors influencing the risk of heat injury. 13. Provide suggestions for the fitness participant to follow to minimize the likelihood of heat injury. 14. Describe in general terms the guidelines suggested for running road races in the heat. 14. Describe the three elements in the heat stress index and explain why one is more important than the other. Also, list the factors influencing hypothermia. 17. Explain what the wind chill index is relative to heat loss. 18. Explain why exposure to cold water is more dangerous than exposure to air at the same temperature. 19. Describe what the CLO unit is and how recommendations for insulation change when one does not exercise, when one does exercise. 19. Describe the role of subcutaneous fat and heat production in the development of hypothermia. 20. List the steps to follow to deal with hypothermia. And 21. Explain how carbon monoxide can influence performance and list the steps that should be taken to reduce the impact of pollution on performance. For those of you who are taking notes, the following outline will be helpful. Altitude would be one topic, heat will be the second, cold will be the third, and air pollution will be the fourth. We will begin with altitude. What we look at with atmospheric pressure is we see a decrease at higher altitude. In addition, when we look at partial pressures, we see the same percentages of oxygen, carbon dioxide, and nitrogen in the air at higher altitude, but a lower partial pressure of the three gases. Hypoxia is going to refer to a low pressure of oxygen at altitude, where the normoxia is a normal pressure of oxygen at sea level. Also, there is a term called hyperoxia, which is a high pressure of oxygen. Now, when we look at the effect of altitude on performance, we see that in short-term anaerobic performances, the lower the pressure of oxygen at altitude should have no effect on performance, where the O2 transport to the muscles does not limit performance. In addition, the lower air resistance may actually improve performance. However, in long-term aerobic performances, we see that the lower pressure of oxygen results in poorer aerobic performance, and this is dependent upon the oxygen delivery to the muscles. So if we look at a comparison of the performance in the 1964 Olympics in Tokyo and the 1968 Olympics in Mexico City, we can see these results. These are listed in Table 24.1, where you look at the short races from the two Olympics, and in Table 24.2, where you look at the long races between the Olympics. Now, when we discuss the topic of jumping through thin air, we would refer to Bob Beamon, who set the new world record for the long jump in the 1968 Olympic Games in Mexico City at a length of 29 feet and 2.5 inches, with a lower air density at a higher altitude. So how much was gained at altitude? When we look at biochemical calculations, it indicates that only 2.4 centimeters were gained at the high altitude. So in summary, the atmospheric pressure, the pressure of oxygen, air temperature, and air density decrease with altitude. We also see a lower air density at altitude that offers less resistance to high-speed movement, and sprint performances are either not affected or are improved. Now looking at the maximal aerobic power and altitude, we see there is a decrease in the VO2 max at higher altitudes. This is primarily due to the low oxygen extraction. Now if we move up to moderate altitudes, approximately 4,000 meters, we see a decrease in the VO2 max due to a decreased arterial pressure of oxygen. However, at higher elevations, the VO2 max reduction is also due to the fall in the maximum cardiac output, which is a decreased maximal heart rate at altitude. The following graph shows the changes in VO2 max with increasing altitude. Now, if we look at the effect of altitude on submaximal exercise, we see that it first elicits a higher heart rate, and this is due to the lower oxygen content in the arterial blood. It also requires higher ventilation due to the reduction in the number of O2 molecules per liter of air. This graph below shows the effect of altitude on the heart rate response to submaximal exercise, where we see there's an increased heart rate. And this graph shows the effect of altitude on the ventilation response to submaximal exercise, where we see with increasing altitude an increase in pulmonary ventilation. In summary, distance running performances are adversely affected at altitude due to the reduction in the partial pressure of oxygen, which causes a decrease in hemoglobin saturation and the VO2 max. In addition, up to moderate altitudes, approximately 4,000 meters, the decrease of the VO2 max is due primarily to the decrease in the arterial oxygen content brought about by the decrease in atmospheric O2 pressure. At higher altitudes, however, the rate at which VO2 max falls may be due to an increase in the reduction of the maximal cardiac output. If we're looking at submaximal performances conducted at higher altitude, we see that they require a higher heart rate and ventilation responses due to the lower oxygen content of the arterial blood and the reduction in the number of oxygen molecules per liter of air, respectively. Now looking at the acclimation to high altitude, we see that there is a production of more red blood cells. This leads to higher hemoglobin concentrations via erythropoietin. This counters the desaturation caused by the lower partial pressure of oxygen. This is the primary adaptation among the Andean residents. We also see a greater oxygen saturation. This is due to an increase in blood flow to the lungs, which is increased by nitric oxide. This is the primary adaptation among the Himalayan Sherpas. Also, we see a lifetime altitude residents that have a complete adaptation of arterial O2 content and VO2 max. These adaptations are less complete in those living at altitudes later in life. In summary, the Andeans adapt to high altitude by producing more red blood cells to counter the desaturation caused by the lower partial pressure of oxygen. The Andean altitude residents who spent their growing years at altitude show a rather complete adaptation as seen in their arterial oxygen content and VO2 max values. Lowlanders who arrive as adults show only a modest adaptation. In contrast, the Tibetan high-altitude residents adapt by increasing the oxygen saturation of the existing hemoglobin as a result of an increased blood flow to the lungs due to nitric oxide. Now, training for competition at altitude, we see the effect of training at altitude on VO2 max varies among athletes. This is due to the degree of the saturation of hemoglobin. Some athletes can improve VO2 max by training at altitude, while others cannot. This may be due to the training state before arriving at altitude. In addition, some athletes have a higher VO2 max upon return to low altitude, while others do not. This also could be due to detraining effect, which they cannot train at as a high intensity at altitude. The model to follow is seen to be the live high, train low model, or potentially the reverse. The idea is to live at a high altitude, which elicits an increase in red blood cell mass via erythropoietin. This leads to an increase in the VO2 max. When you look at living at a greater than 22 hours per day, at 2,000 to 2,500 meters is required, or its simulated altitude of 2,500 to 3,000 meters for 12 to 16 hours per day. This can be accomplished by intermediate hypobaric hypoxia. For example, 3 hours per day, 5 days per week at 4,000 to 5,000 meters. However, in contrast to living at the high altitudes, you would want to train at the low altitudes and be able to maintain high interval training velocity, and some athletes will still experience hemoglobin desaturation at this point. In addition, we traditionally see an increase in red blood cell mass, which leads to an increased VO2 max as a result. Some studies have shown improved VO2 max without increased red blood cell mass, however. This happens with intermittent hypoxia, and the potential mechanisms are improved myocardial function as well as an increased buffering capacity. This is an area of active debate and research. There's also the live low, train high model, which avoids the negative effects of prolonged altitude exposure, but no real changes in VO2 max or hemoglobin concentrations are seen. In summary, when athletes train at altitude, some experience a greater decline in the VO2 max than others. This may be due to differences in the degree to which the athlete experiences a desaturation of hemoglobin. Remember, some athletes experience desaturation during maximal work at sea level. In addition, some athletes show an increase in VO2 max while training at altitude, while others do not. This may be due to the degree to which the athlete was trained before going to altitude. In addition, some athletes show an improved VO2 max upon return to sea level, while others do not. Part of the reason may be the altitude at which they train. Those who train at high altitudes may actually detrain due to the fact that the quality of their workout suffers at the high altitudes. To get around this problem, one can alternate low altitude and sea level exposures to follow a live high, train low program. Now, looking at the quest for Everest. Mount Everest was first successfully climbed in 1953 using supplemental oxygen, and it was climbed without oxygen in 1978. This was previously thought that this would be impossible, where the VO2 max at the summit was thought to be just above rest. Actually, the VO2 max estimated at 15 milliliters per kilogram per minute due to the miscalculation of barometric pressure at the summit. Now, if we look at this chart, we see that the highest altitude attained by climbers in the 20th century. This is both looked at with oxygen used and without oxygen used. Now, in this graph below, we see that the maximal oxygen uptake measured at a variety of altitudes, including the summit of Mount Everest. Now, looking at the challenges of high altitude climbing, we see that successful climbers have a great capacity for hyperventilation. This drives down the partial pressure of carbon dioxide and the hydrogen ion concentration in the blood. This allows for more oxygen to bind to hemoglobin at the same partial pressure of oxygen. Climbers must contend with the loss of appetite, however, which will lead to weight loss and a reduction in type 1 and type 2 muscle fiber diameter. Now, if we examine the lactate paradox, we see upon exposure to altitude, there's a higher heart rate, ventilation, and lactate during exercise due to hypoxia. However, after acclimatization, the lactate response is reduced, despite continued hypoxia. Now, the causes of this lactate paradox include a lower plasma epinephrine and may also be due to muscle adaptations. There is great debate about this topic. What causes this lactate paradox? Or does it even exist? Some studies do not observe this phenomenon. In summary, climbers reached the summit of Mount Everest without oxygen in 1978. This surprised scientists who thought VO2 max would be just above the resting VO2 max at that altitude. They later found out that the barometric pressure was higher than they had previously thought, and that they had estimated the VO2 max was about 15 milliliters per kilogram per minute at this altitude. Those who are successful at these high altitudes have great capacity to hyperventilate. This drives down the parcel pressure of carbon dioxide and the hydrogen ion concentration in the blood and allows more oxygen to bind at the same arterial pressure of oxygen. Finally, those who are successful at climbing to extreme altitudes must contend with the loss of appetite that results in a reduction in body weight and the cross-sectional area of type 1 and type 2 muscle fibers. Now moving on to heat, we see that hyperthermia is an elevated body temperature. And we can examine heat-related programs such as heat cramps, heat exhaustion, which may require medical attention, and heat stroke, which will lead to a medical emergency. Treatment involves cold water immersion and is the most rapid way to lower the body temperature. In the following table, you can reference in your book, we can see the heat-related problems and their treatments. Now, if we look at factors related to heat injury, we would see first fitness, where higher fitness is related to a lower risk of heat injury. This would also involve the ability to tolerate more work in heat, acclimatization faster, and sweat more. Fit individuals still have a risk for heat injury, however. Also, looking at acclimatization, we see that exercise in the heat for about 10 to 14 days. What we would want for this would be lower intensity, long duration exercise, and/or moderate exercise intensity at shorter durations. The adaptations that occur are an increased plasma volume and capacity to sweat, an increase in VO2 max, maximal cardiac output, lactate threshold, and performance. You'd also see a lower body temperature and heart rate response, as well as a reduction in sodium loss and sweat. The best protection against heat stroke and exhaustion. Continuing with factors related to heat injury, we see that hydration is important, and an inadequate hydration increases the risk of heat injury. Also, no differences among water electrolyte drinks or carbohydrate electrolyte drinks matter. When looking at environmental temperatures, we see that convection and radiation dependent on the gradient between the skin and the air temperature occur, and higher temperatures may result in heat gain. Clothing is also important, and you want to expose as much skin as possible. Also, choose materials that wick the sweat away from the skin. In addition, humidity is important, also which is called the water vapor pressure. Evaporation is dependent upon the gradient between the skin and the air, and the relative humidity is a good index of water vapor pressure. Also, you would need to consider a metabolic rate where the core temperature is proportional to the work rate. What we see is that a high work rate increases the metabolic heat production. In addition, we would want to factor in wind, because wind will increase the heat loss by convection and evaporation. The diagram below shows all the factors that affect heat injury. In addition, in this graph, we see the effect of different types of uniforms on body temperature. Now, the implications for fitness are as follows. To know the signs and the symptoms of heat illness, like cramps, lightheadedness, etc. To exercise in the cool parts of the day. To gradually increase exposure to heat and humidity to acclimatize. You would want to drink water before, during, and after exercise. To wear light clothing. And to monitor heart rate and alter exercise intensities by staying within the target heart rate zone. Now, if we look at the implication for performance, we see an emphasis on pre-season conditioning to improve fitness and promote acclimatization. We also want safety during the events in high heat or humidity. We will look to compete at cooler time of the day or the season of the year. We would want frequent water stops and encourage drinking of 150 to 300 milliliters of water every 15 minutes. We would want identification of those with heat illness. We would want to coordinate proper treatment, such as first aid, ambulance services, and hospitals, and we would want for competitor education to provide information about heat illness. Now, looking at environmental heat stress, what we would look for is a wet bulb globe temperature, where if we have a dry bulb temperature, the air temperature is in the shade. The black globe temperature is the radiant heat load in the direct sunlight, and the wet bulb temperature is the index of the ability to wick sweat, the most important in determining the overall heat stress. And what we see is the risk of heat stress depends directly on the WBGT. Now, when we're looking at the risk of exercise-related heat stroke, we can see that at different temperature, the WBGT increases as the heat goes up. From a low risk, which is below 50 degrees Fahrenheit, where the risk is actually for hypothermia, all the way up to an extreme risk of hyperthermia, where you may want to cancel or postpone the event. Please review the different categories in related to heat stroke risk. In summary, heat injury is influenced by environmental factors such as temperature, water vapor pressure, acclimatization, hydration, clothing, and metabolic rate. The fitness participant should be educated about the signs and symptoms of heat injury. The importance of drinking water before, during, and after the activity gradually becomes acclimated to the heat, and exercising in the cooler parts of the day, dressing appropriately, and checking the heart rate on a regular basis. Also, road races conducted in times of elevated heat and humidity need to reflect the coordinated wisdom of the race director and medical director to minimize the heat and other injuries. Concerns include running the race at the correct time of the day, the season of the year, frequent water stops, traffic control, race monitors to identify and stop those in trouble, and communication between race monitors, medical directors, ambulance services, and hospitals. Also, the heat stress index includes a dry bulb, wet bulb, and globe temperatures. The wet bulb temperature, which is a good indicator of the water vapor pressure, is more important than the other two in determining the overall heat stress. Now, moving from heat to cold, the main issue would be hypothermia, where the core temperature is below 35 degrees Celsius. If we see a 2 degrees Celsius drop, it is associated with maximal shivering. A 4 degrees Celsius drop is associated with ataxia and apathy, and a 6 degrees Celsius drop is associated with unconsciousness. Further drops associated with ventricular fibrillation, reduced blood-brain flow, asystole, and death. Heat loss exceeds heat production due to conduction, convection, radiation, and evaporation. It is important to protect against the heat loss and maintain the core temperature. The diagram below shows all the factors affecting hypothermia. Now, looking at the environmental factors, we see that there is temperature, which is a gradient for convection of heat loss. There's also vapor pressure, which low water vapor pressure encourages evaporation. In addition, there's wind, which influences the rate of heat loss influenced by the wind speed, and a wind chill index, which is the quote-unquote effective temperature. In addition, there's water immersion, where the rate of heat loss is 25 times greater than in air at the same temperature. In this table, we see the wind chill chart, which can be referenced in your book. Here's a graph of the effect on water temperature on survival. So in summary, hypothermia is influenced by natural and added insulation, environmental temperatures, vapor pressure, wind, water immersion, and heat production. The wind chill index describes how the wind lowers the effective temperature in the skin, such as convective heat loss is greater than it would be if the calm air at the same temperature. Also, water causes heat to be lost by convection 25 times faster than it would be by exposure to air at the same temperature. Now, when considering insulating factors, we would see subcutaneous fat is especially effective in cold water. Also, clothing. You have CLO units, where 1 CLO is insulation needed to maintain the core temperature at rest at 21 degrees Celsius, at 50% RH, and at 6 meters per minute of wind. Increased clothing required in cold, wet, and windy conditions. In addition, dry clothing is more effective than wet. Also, the amount of ventilation is required is lower during exercise. Now, when we examine heat production, we see that heat production increases upon exposure to cold. This is an inverse relationship between VO2 and body fatness. The earlier onset of shivering is seen in lean men, and the resting VO2 and core temperature is maintained in fat men in cold water. Also, the increased VO2 and a decreased core temperature is seen in thin men. We want to also examine the fuel use, as fat is the primary fuel for shivering, and shivering can lead to muscle glycogen depletion. Now, looking at the descriptive characteristics influencing responses to cold exposure, we see first by examining gender that at rest, women show faster reduction in body temperature than men. However, in cold water, the decrease in body temperature is similar between men and women. These differences can be explained by body composition. Also, when looking at age, we see that older people greater than 60 years old are less tolerant to cold, and children experience a faster fall in body temperature. Below is a chart that reflects the changes in insulation requirements at different temperatures and activities. In summary, subcutaneous fat is the primary natural insulation and is very effective in preventing rapid heat loss when a person is exposed to cold water. Also, clothing extends this insulation, and the insulation value of clothing is described in CLO units, where a value of 1 describes what is needed to maintain core temperature while sitting in a room set at 21 degrees Celsius and 50% RH with an air movement of 6 meters per second. Also, the amount of insulation needed to maintain core temperature is less when one exercises because the metabolic heat production helps maintain the core temperature. Clothing should be worn in layers when exercising so no one can shed one insulating layer at a time as the body temperature increases. Also, heat production increases on cold exposure to cold with an inverse relationship between the increase in the VO2 and the body fatness. Women cool faster than men when exposed to cold water, exhibiting a longer delay in the onset of shivering and a lower VO2 despite a greater stimulus to shiver. Now, when dealing with hypothermia, we want to look at the effects of hypothermia first. What we see is a reduction in coordination, slurred speech, and impaired judgment. When we're looking to treat hypothermia, however, which would be mild to severe, we first want to get the person out of the cold, wind, and rain. We want to remove all wet clothing and provide warm drinks and dry clothes. In addition, you would want to put the person into a sleeping bag with another person if semi-conscious and find a source of heat while preparing for emergency treatment and/or evacuation. In summary, for mild hypothermia, get the person out of the wind, rain, and cold, and remove wet clothing and put on dry clothing. For rewarming, apply heat only to the trunk and other areas of heat transfer and provide warm drinks and food. For moderate to severe hypothermia, do as above and check vital signs, activate emergency medical system, and transport. Now, moving on to air pollution, we see that there's a variety of gases and particles. These all have a detrimental effect on health and performance, where there's a decreased capacity to transport oxygen, there's an increased airway resistance, and altered perception of effort. The physiological responses depend on the amount of dose received, which would be involved in the concentration in the air, the duration of the exposure, and the volume of the air inhaled, which would increase during exercise. We also want to look at the particulate matter, which would promote pulmonary infection, which would elevate blood pressure, reduce fibrinolysis, and reduce vasodilation, and cause oxidative stress and DNA damage. There's also ozone, which decreases the VO2 max and respiratory function, sulfur dioxide, which causes bronchoconstriction in asthmatics, and carbon monoxide, which binds to hemoglobin and reduces oxygen transport as well as affects the submaximal exercise and VO2 max. This graph shows the effect of carbon monoxide on the VO2. Now, when looking at preventing air pollution problems, the first thing we want to do is reduce exposure time as effects are dose dependent. In addition, stay away from bolus amounts of the pollutants in smoking areas, high traffic areas, and urban areas. In addition, do not exercise during the most polluted parts of the day, which are from 7 to 10 a.m. and 4 to 7 p.m. You can also monitor the air quality index, which is a measure of 5 pollutants, and the AQI scale runs from 0 to 500. Here you will see a chart showing you the air quality index. In summary, air pollution can affect performance. Exposure to ozone decreases the VO2 max and respiratory function, while sulfur dioxide causes bronchoconstriction in asthmatics. Also, carbon monoxide binds to hemoglobin and reduces oxygen transport. To prevent problems associated with pollution of any type, reduce exposure time, Stay away from the bolus amounts of the pollutant and schedule activity at the least polluted parts of the day. Finally, air quality index should be monitored to determine if conditions are safe for exercising outdoors. This concludes the content for Chapter 24. Next, our listed study questions will help to test your knowledge of the chapter and help you learn it in more detail. Question 1. Describe the changes in barometric pressure, the partial pressure of oxygen, and the air density with increasing altitude. 2. Why is the sprint performance not affected by altitude? 3. Explain why maximal aerobic power decreases at altitude and what effect this has on performance in long-distance races. 4. Graphically describe the effect of altitude on heart rate and ventilation responses to submaximal work, and provide recommendations for fitness participants who occasionally exercise at altitude. 5. Describe the process by which an individual adapts to altitude and contrast the adaptation of the permanent residents of high altitude with that of a lowlander who arrives there as an adult. 6. While training at altitude can be beneficial, how could someone detrain? Also, how can you work around this problem? 7. It was formerly believed that a person could not climb Mount Everest without oxygen because of the estimated VO2 max at altitude was close to the basal metabolic rate. When two climbers accomplished this feat in 1978, science had to determine how this was possible. What were the primary reasons allowing the climb to take place without oxygen? 8. List and describe the factors related to heat injury. 9. What is the heat stress index, and why is the wet bulb temperature weighed so heavily in this formula? 10. List the factors related to hypothermia. 11. Explain what the wind chill index is relative to the convection heat loss. 12. What is the CLO unit, and why is the insulation requirement less when you exercise? 13. What would you do if a person had hypothermia? 14. Explain how carbon monoxide can influence VO2 max and endurance performance. And 15. What steps would you follow to minimize the effect of pollution on performance? This concludes Chapter 24, focusing on exercise and the environment. Please reference the lecture and the text if you have additional questions or to study further. Also, you can email me at any time with any questions. Thanks.